If you're searching for a Heidi AI alternative, you're probably not just looking for another AI scribe. You're trying to find a tool that fits your specialty, your documentation style, your workflow, and your budget. Heidi is one of the more well-known AI scribe tools in healthcare, and for many clinicians, it can be a good option. But AI scribes are not all the same. Some are built more for large health systems, some are better for small practices, some are stronger for therapy notes, some are better for fast SOAP notes, dictation, or flexible templates. So instead of asking, what is the best AI scribe overall? The better question is, what is the best AI scribe for the way I actually document? The first thing to compare is specialty fit. A therapist, psychiatrist, primary care provider, physical therapist, and chiropractor may all need very different notes. For example, a mental health clinician may care about DAP, BIRP, GIRP, treatment plans, interventions, patient response, progress toward goals, and insurance-compliant language. A medical clinic may care more about SOAP notes, assessment and plan, follow-up instructions, and clean documentation for billing. So when comparing Heidi alternatives, look at whether the platform can adapt to your actual clinical workflow. This is one area where Twofold is often a strong fit, especially for therapists, psychiatrists, behavioral health clinics, and small to mid-sized practices that need flexible clinical documentation. The second thing to compare is template control. Some AI scribes create a clean note, but it may not match how you actually chart. You may want a specific SOAP structure, a DAP note with custom sections, or a behavioral health note that includes medical necessity, interventions, client response, plan, and progress toward treatment goals. A good Heidi AI alternative should let you customize the note without a complicated setup. With Twofold, clinicians can use different note formats, customize templates, and generate notes that better match their preferred documentation style. The third thing is ease of use. Most clinicians do not want another complicated system. They already have an EHR, scheduling, billing, messages, and a full patient load. The AI scribe should fit into the workflow without forcing the clinic to change everything. For many practices, the ideal workflow is simple. Record or dictate the visit, generate the note, review it, edit if needed, and move it into the EHR. That is why tools like Twofold can be especially useful for small and medium practices. It is designed to be fast, easy to start with, and practical for real clinical workflows. The fourth thing is privacy and compliance. Any AI scribe used in healthcare should be designed for clinical documentation, support HIPAA-compliant workflows, and offer a BAA when needed. You also want to understand how the tool handles patient data, whether it is built for healthcare, and whether you can review and approve the final note before it goes into the chart. So, who is Twofold a good fit for? Twofold is a strong Heidi AI alternative for clinicians and clinics that want fast AI-generated clinical notes, flexible templates, SOAP, DAP, BIRP, and other note formats, HIPAA-compliant documentation support, and simple setup without a long implementation process. It is especially relevant for therapists, psychiatrists, behavioral health teams, and small clinics that want something practical and easy to use. The best Heidi AI alternative depends on what you actually need. But if you are looking for a fast, flexible, HIPAA-compliant AI scribe for clinical notes and documentation, Twofold is definitely one to consider.